Good morning.
Good morning.
So thank you
Good
for
to see you.
accepting our invitation. I know that I didn't send you any questions because I know that we can be very natural, and I love people to see just what's natural and what comes rolling. So I know that you are a very famous sports medicine doctor.
Thank you.
I
A little bit.
You're well known. I'm fascinated because we see so many patients that are having bone and the joint problems. And the biggest aging population is the baby boomer. So before we start, tell me and tell our patients who you are, how do you become a doctor, and how did you choose the sports medicine field?
I'll try to be as brief as possible.
Yeah.
Being Hispanic, I love talking.
So we get
But
to the questions, right?
yes. My name is Dr. Moises Irizarry, and I'm a primary care sports medicine physician and also specialist in the regenerative medicine field. My passion for sports medicine came from the fact that growing up, I was always the kid that was not picked to do sports in the team. I was the shortest, I was the chubbiest, I had asthma, I had a lot of medical issues that stopped me from achieving my goal.
Mhm.
But coming from humble origins and my family being a family of faith, my mother and father always taught me, you know what, you can be whoever you want to be. And they believed in me, even though sometimes perhaps I doubted myself.
Right.
So that helped push myself towards, I want to do what I've never been able to do, which is engage in the world of sports. And once I was accepted into the medical school, out of all the fields, the one that interested me the most was that thing that I was obsessed with as a kid of not only wanted to do sports for myself, but I
Mhm.
wanted to help people who were in the same situation. People who thought they would never be able to, this is not for me. So, because of an injury, because not being raised properly, because they never trained before. So, I decided to focus not only on the high end athlete, but also on people who have been forgotten and in one way or another are also athletes, such as the cleaning lady that's working a lot, at home,
Right.
or the person that's working in the garden, or any of us who's doing repetitive activities.
Wow. So I didn't know that because when I
Mhm.
look at you, you look so fit and you're
Yeah,
so
nah,
healthy. So we have come a long way, huh?
yes, very, very long way.
Oh, that's interesting because that means that you have real, actual advice for patients that were eating the wrong diet,
Absolutely.
right? So why don't we speak about that? What are your five top recommendations for people that are not in good shape and they don't feel strong and everything hurts? Like diet wise, for example. Give me your five.
Okay. Okay, I will tell you one of the things, and it's not because I'm talking to you. This is something I actually always advise to patients. It's number one, find someone who can help you with your oral hygiene. We are what we eat.
Right.
And it does not matter how great the vegetables we eat and how healthy we eat. If we don't take care of where it's coming through, that's going to be a problem. As our mouth reflects a lot of our illnesses, and we forget about it. We only think about our blood pressure, our fever, but there's a lot that happens in the oral cavity. So
Mhm.
number one, don't fall for any fad diet out there.
Mhm.
There's a lot of fads, and just like
People
in
are confused. Yeah.
yes, it's very confusing. If it was not for my particular knowledge, I
Uh-huh.
find that many other doctors are confused themselves. So
Right.
it's important to find someone that's a good nutritionist or a doctor with a good nutritional background that can help
Mhm.
you guide you towards your goal, because that's
Right.
important.
Mhm.
First of all, identify your goal. Once you have your goal and you share it to the doctor, is number one, hydrate properly. Cleanse your mouth all the time and keep it clean at all times. Number two, intermittent fasting is good, but there's different types of
Mhm.
intermittent fasting, and it depends on your overall health,
Mhm.
right? That's another thing.
Right.
Another one is don't eliminate, and there's very little things as food that we have to eliminate complete.
Mhm.
So don't go to any extreme because any extreme is hard to follow, right?
I tell my patients anything on a can, anything on a box, you don't eat. It has to
Absolutely.
be fresh. If people say, I don't do diet and I'm fit because whatever I eat is fruits, vegetables, things that are really high quality. And
Yeah,
it's not expensive actually. You go
it
to
is not.
you go to the green market and you get like for $100, you get like 3 bags of vegetables. You can cook for
Yes.
2 weeks. It's terrific,
Yes.
right? But people go to anything that's in a can or say a dressing. A dressing. It'll cost you $8.
Yeah.
You could have done it in your house for like $1 and
Absolutely.
and keeping it simple.
Yeah. And now that you mentioned that, it's very important because I was recently in Japan for 2 weeks. And
Ooh,
one thing I did
ah,
notice, one thing I did
they're
notice
so
was,
clean. There's no
yes,
garbage in Japan.
yes. And their use of preservatives is so rare
Uh-huh.
that even though I'm telling you, I ate everything I could find, even
Yep.
fried chicken. And I normally don't eat fried chicken,
Uh,
everything I could find in the streets. And I realized that after 2 weeks, I lost 6 pounds, which tells me,
wow.
yes, which tells me, what are we putting in our food here in the
Right, right,
restaurant?
right.
Remember often when we go
Preservatives.
to,
Preservatives.
yes,
You go to a
preservative.
restaurant. I love cooking in my house. My house looks like a chemical lab, with the seeds and the things. But honestly, I find the same thing when you go out to eat in a restaurant. They use things with preservatives, obviously, and then that your body cannot metabolize. So,
Yeah.
your cells get swollen, inflamed.
Yes, and it's becoming part of your body like forever, and it's causing a lot of health issues that we're seeing.
Yeah.
Yeah, and like you were saying, to keep it short, what you were saying, yes, some of my family argue, yeah, but going to eat all these vegetables are going to cost me more than buying the
It's not.
fried garbage that they eat.
It's
I
not.
said, think of this. Yeah, I said, not only is it not true, but if you take just one day to cook and compartmentalize and just put in, okay, this is going to be my food for the next 3 days,
Yes.
you realize it ends up being cheaper.
Yeah, yeah. I do it. I agree with you. I prep on Saturday, Sunday. I go on Saturdays and I go to like a green market and I buy everything fresh. And you know what? It's like I cut everything, I prepare everything, and I make my foods on the weekend for the week. It's so easy
Hmm.
because I bring my lunch, I have my breakfast. It's fast and it's healthy, and it really
Hmm.
gives you a lot of energy. And
Yeah.
some of my employees tell me, you always have so much energy. Well, because I'm eating energy.
Yeah.
The food is your fuel, and let the food be your medicine too.
Absolutely. And if you do it well, you do
Yeah,
not rely so much on caffeine. People drink a lot of coffee
right,
because like you said, they don't have energy because they're not consuming the right things.
right. Yeah, green tea in the morning or matcha tea, it's great. It
Yes.
has a lot of catecholamines, and then
Hmm.
it's, chemicals that are going to give you energy and anti-cancer. So it's like a win-win-win.
Hmm.
So what other things do you do?
Well, I try to exercise regularly. And
Yes,
because my schedule is very crazy and unpredictable, I travel a lot, I work long hours. Well, I have to make an effort to wake 5 in the morning to
yes,
work out. Believe
yes.
me, I don't like to work out at 5 in the
But your
morning.
day
I
is
don't.
fantastic. Yeah,
But yeah, but if I don't do it at that one time, for me,
yeah,
I know that in the afternoon, I'm not going to be able to do it. I won't have the energy. So I
yeah,
said, let me do a short, high intensity workout of
yeah,
just 30 minutes,
yeah.
and it's going to produce more than being 2 hours on a treadmill in a gym.
Awesome, awesome. So you preach and you do what you preach.
Yes,
I
I
love
do.
it. I love it. So if you were going to recommend somebody now that is a baby boomer, a person that is seeing like the changes in their body, in the bones, in their joints, what kind of foods or even supplements do you recommend for somebody that has achy joints?
Okay, something very important. And I'd like people to take vitamin D3. I
Yes.
mean, make sure they have a good source of calcium, not only on a supplement, but also as part of their diet.
Hmm.
There's a there's some broths and there's some vegetables that are rich in calcium, and it's important to keep those balanced.
Yeah.
Especially one thing people forget about, they just go and look online of what is my daily calcium intake. Well, that is for someone who doesn't exercise at all.
Right.
But if you're trying to exercise or walking around the neighborhood,
Yeah.
consult your doctor because you might need a little more calcium or vitamin D
Yeah.
so that you can absorb that better. Magnesium is great.
Yeah.
It's also it helps the calcium bind into the bone, and it also helps as a muscle relaxant,
Mhm.
zinc. I mean, just a good, well-balanced multivitamin, sports
Yeah.
multivitamins can help.
Yeah, absolutely. I went to the A4M on this weekend, the medical conference in West Palm Beach, and we love going there. So they had a machine that measures your oxidation, how many antioxidants you have. And I was the highest in the whole convention center.
Wow.
Yeah. They were like, what? And then I said, I brought on my team. I brought all the doctors that I knew. I'm going to check you. And the guys were like, wow, you're bringing everybody to the booth. I said, no, because I want to know if what they do is working. So obviously it's not working. So we have to I measure my vitamins, like say the D level. People
Mhm.
think that 30 is fine. No, I want 100. I want to be on
Yes.
100. And the way that I do in the morning, I live by the beach. I see the sun, the sun's rising, and I go downstairs and I ground, and I get that
Mhm.
first morning, walk. And today I went to the ocean, so my hair is wet right now. So there's a lot of things that should be measured, don't you think?
I absolutely, and I tell you this, those things give us a good dose of reality, and it's important for
Mm.
us to, and at least once or twice to do that, and then we see, like you said, all the sacrifices I'm doing, are
Yeah,
they worth it? At
right.
number one,
Is it
or are
worth
they the right ones, or are they the right ones?
Yeah.
You know?
Because sometimes you're taking supplements and your body's not absorbing it. For example, I was
Hmm.
doing omega 3s and it shows omega 3 deficiency. So the doctor put me in different, omegas. None
Yeah.
of the omegas my body absorbs. I want you to know. So I
Mm.
have to eat fish,
Yeah.
and I do on my morning, I always do chia seeds and flax seeds that has a lot of omega 3s. So I like to measure my blood every 3 months.
Yes, which is ideal.
Because if the car needs oil,
Hmm.
modify it, right?
Yeah.
So what is the trend? Like, I'm going to tell you what I see is happening in the dental world. In the
Hmm.
dental world, post-COVID, we're seeing patients, not only me, but there is like people reporting this, that people are getting osteonecrosis on the jaw. Okay. So
Yes.
I have like a young person that never had a cavity, never had gum disease, and now we do a CT scan and they have osteonecrosis of the jaw, which means that the jaw is rotting. So I would think that in your field, are you seeing things like that?
Yes, as a matter of fact, I was discussing that with a patient just yesterday
Mhm.
because I am seeing more osteonecrosis of the hip in younger people.
Isn't that
And
scary?
yes, and this woman was telling me, hey, what do you think causes? I said, you know what? At this point, I'm
Mm-mm.
not going to go down the rabbit hole of if it was the virus, if it was the vaccine, if it was, we don't know.
It's there.
It's there. We just need to deal with it.
Yeah. How are we
And
going to fix it? So what do you do? Hyperbaric oxygen?
yes, hyperbaric oxygen is very helpful to direct oxygen into the area. Sometimes when the osteonecrosis is just starting, you can actually inject it with an ultrasound-directed injection of PRP, of plasma, that you can also use for
Ah,
the jaw and helps. But in cases that are more severe, that the bone is disintegrating, you can get bone marrow stem cells from the own patient, autologous stem cells, inject them. And there's plenty of research that shows remineralization of the head of the femur, and that can help save it.
so you start with the ultrasound PRGF, and then
Mhm.
how long do you follow it and then decide to go with the bone marrow?
About 2 to 3 months later, depending on the case, we
Okay.
can see, yeah, we'll see the changes. We don't follow it on X-ray, you follow it on an MRI because it's more
Right.
sensitive and it shows you if the bone is getting weaker when the X-ray will not see it. And if
Right.
it's already going in the right direction, then maybe you do another injection of PRP or PRF. If
Mhm.
it's not responding, you need to save that joint so that
Right.
it's not replaced. Like replacements are great, but in the orthopedic world, replacements at best last about 15 years.
Right.
And that's a problem. So if we can save the joint, we can. And often we're able to do it with PRP. The more severe cases, we
Mhm.
do it with a painless bone marrow aspiration, inject it into the joint, and it's almost like magic.
That's awesome. So we have a lot of professional athletes as well. And then one of the things that they even own the hyperbarics. They
Hmm.
travel with their hyperbarics. I recommend hyperbarics to all my patients that I do surgery, all of them.
Yes.
And the ones that do is amazing. In 7 days, they're healed. You know, you have to do everything in your toolbox to accelerate and ensure, you know, people that are compromised, immunocompromised,
Hmm.
people that are aging, people with cancer. You know, I am seeing more young people with cancer that I ever saw in my life.
Yes.
Are you seeing that as well?
I am seeing that. I am seeing very sad cases. Like I've been in the field 22 years now. And
Mhm.
it's only in the last, I would say, 7 to 8 years where I've seen such a huge incident of cancers from multiple sources. And we've gone down the rabbit hole of trying to save money using cheap things, eating cheap things,
Right.
doing, I mean, radiation exposed
Plastic,
to the phone,
EMS.
not being grounded properly. So many things that we need to take a step back and say, you know what? We need to fight this as much as we can with good antioxidants, good diet, good
Mhm.
exercise, good rest. I
And
mean,
good
proper
people.
oxygenation.
And good people.
Absolutely.
I was looking forward to doing the interview with you because you are so much fun and you have such a charismatic personality. So it's very attractive to do and communicate with people that raise your levels of energy. Another thing,
Absolutely.
you're very authentic. I love that. So they have found that in measuring energy fields, love is at 200, being
Yes.
authentic is at 4,000.
Huh.
So you see the difference?
Yeah, that must be 4,200 then.
That's right, because you have a little spice there from Puerto Rico.
Yeah.
So, you know, we see a lot of cancer patients because everything is connected. Like you said, whatever's
Absolutely.
in your mouth is connected to your body. So I do about 650 surgeries a year, and I've been doing this for like over 26 years. So I have done thousands and thousands of surgical extractions, of root canals, because a lot of surgeons didn't want to do them. Patients
Hmm.
would come and say, "Hey, I read that this doctor had a root canal and he got paralyzed." And one of them is very famous. His name is the doctor that invented the LASIK. Yeah, he had a root canal done and he was very successful, young scientist, and he invented the LASIK. And he was like going up with fame. And he got a root canal. He was in pain. He got a root canal, and he was in bed for 7 years. So he started studying as a scientist. He had very little energy, so he started studying. And he's like, something is studying my energy flow. He got into a book that was written by a famous endodontist. It was a research of what the root canals had in them. So it's a dead tooth. So they figured, let me put it in the autoclave. And then they would put their tooth under the skin of a rat. And then the rat would get the same disease as a patient. So if the patient
Ah,
was in a wheelchair, couldn't walk, well, the rat couldn't walk. So if the patient had whatever the patient had, the animal would mimic the
we
same
started.
disease. So, you know, he renounced, he's like, I can no longer do root canals. You know, he was the
Yeah.
president of the Endodontical Association, wrote a book, got a lot of slack, you know, people mock it. But the truth is that after 26 years of doing patients, we see that the patients that come with breast cancer have a root canal in the breast meridian.
Yeah.
The persons that I had patients with other problems, neurological, in wheelchairs, MS, AL, dementia, because of mercury. But the root canal thing is a real thing. And we see the young people. I had a lady that flew from Seattle, 28-year-old, colon cancer, root canal on the colon meridian. So she said the moment I got that tooth out, she felt a relief in her gut. And she changed, she got all the mercury out, changed her diet, relocated to Florida. Why am I living in Seattle? So we have so many testimonials. What is your like most amazing case that you have seen from a patient that you have treated?
I'll tell you this. I think the most amazing case I have that I spoke on TV about was this young man who was 28 years old. And he had gone to many people for a hip injury
Mhm.
that he thought, I tried physical therapy, I tried exercises, it's not getting better. And after a careful evaluation, which is important, you
Right.
need to make sure you have a clinician that takes care of you, asks a lot of questions, and looks at you,
Mhm.
not only at an x ray, right? So after all the questions, I said, you know what? I think you still need to do the physical therapy. But I did it. I said, I don't know what type of physical therapy you did. That's the thing.
Right.
I said, I'm going to recommend you to someone that's going to do a good job and you're going to get better in 6 to 10 weeks. He said, but wait, 6 or 10? When he asked that question, I said, 12. He said, what do you mean? He said, you're too worried about the numbers. You're going to mess yourself up. Just
Right.
you're going to get better. So I did not see this guy for 3 years. I had seen him once only. 3 years later, he shows up to my office in a wheelchair.
Oh my God.
And when I see this guy in a wheelchair, I said, wait, I remember your face. What happened to you? He says, doctor, you were right. At
Mhm.
6 weeks, listen to this. I said, at 6 weeks, I was only 85% better. Only 85% better.
Oh,
I said, like, oh my God.
that's not enough. Okay.
Yes. So I said, this doctor already doesn't know anything. So I stopped everything, went somewhere else, ended up in Mexico, where they did a botched surgery where they told him they had to detach his muscles from the
Oh
hip
my God.
and clean them up and reattach them. And he ended up in a wheelchair from all the scar tissue and stuff. And I said, oh my God, you messed yourself up. This was 28 years old, a
Uh-huh.
patient.
So
So you mess yourself.
now it's in his 30s.
Yes. So he says, well, I'm coming for you to help me. I said, I can't help you. I said, you are a problem. You're a walking problem. I can't help you.
You're
And
a
he said,
liability.
yes, but listen to what he said. Listen to what he said. He said, I knew you would say that. And I am an attorney.
Oh
So I'm gonna
yeah.
give,
Yeah.
yeah.
I'm gonna do you right now.
He said, so I'm gonna give you this letter of protection because I know this was my doing. He
Uh,
said, and I'm coming to you as a person begging you for help.
right.
And that I have to tell you something. I felt something from above
Yeah.
that said, I
Yeah.
would have normally discarded him. I said, I would help you.
Yeah.
It's going to take you a very long time, but we're going to get there. And it
Wow.
took us almost 10 years of
Wow.
treatment with biologics, with stem cells and stuff. But that patient is doing capoeira right now, martial arts, playing soccer, doing everything back to normal.
Wow.
And it was the most difficult case I think I've ever seen.
Wow, that's fascinating. We have a big heart, right? So sometimes it's good that he came with the letter because sometimes you want to help people and they're not ready. They're not ready.
There.
So I interview my patients, and a lot of my patients are actual doctors that have waited to do the procedures, and then now they have high blood pressure because if your gums are infected, it goes to your heart. You get endocarditis. I have young people with high blood pressure fit, but the gum disease is damaging the heart. So
Mm-hmm.
I interview people because I want to choose the patients that I would love to work with. Not everybody you want to marry.
Yeah.
It's
Yeah.
like this is like a let me see if I want to marry you interview, right? Because
Yeah.
the energy, right? You're putting your body very close to somebody that the energy is going to affect your energy field. And we have to protect ourselves also, not just a matter of legalities and compliance,
Of
because if
course.
the patient's not going to be compliant, but also who are we allowing in our circle? Can we embrace them and love them? Can they receive that love? Because part of the healing, like you said, is supernatural. God uses us as we are the hands, right? We're the carpenters, but the true healing happens through Him. So
Mm-hmm.
being in tune with that energy and just being able to love on those patients because that's where the real magic happens when you're like really present and just even praying while you're doing it. There's a lot of things going on social media about cold plunging. What do you think of that?
I'll tell you this, cold plunging actually, it's cold plunging has been done since the old ages in the Nordic country.
Right.
And cold plunging done appropriately
Mhm.
can be very helpful in your recovery. The thing is that it's not for everybody. If you're going to be doing cold plunging, you have to have certain blood pressure levels, your health needs to be at a certain, how do I say it, a certain degree. And you have to have a careful evaluation because the changes in blood pressure and the
Okay.
sudden changes in temperature can be problematic for someone who doesn't know if they can do it or not.
Okay.
So,
Well, they don't mention that. So I'm happy that you're mentioning that. I feel like the time that I have done like cryo therapy,
mhm,
not plunging, I barely can go to the ocean if it's too cold. But I feel I'm going to have a heart attack for those 3 minutes.
yes, yes, and it could be because again, it's not. It should be used for several sports, for certain types of activities, of high-end activities. It should not be for you and me who are everyday workout something, going to the gym. It's a little too much of a too big of a change that can be problematic and can induce apoptosis, which is destruction of some cells, which accelerates aging, et cetera, et cetera. So it's not bad. It's not great. It can be either or depending on each particular person.
All right. So that's really, I didn't know that, but it
Hmm.
makes sense because my patients, I have a lot of young cancer patients, and they're like, oh, should I? I'm like, I don't know about that. I
Hmm.
don't
Yeah.
know about that. Wow. So I saw, that you're doing, as we get older, right? We go into menopause and we have even hormonal changes. I even have young people with hormonal changes. We're eating chicken that has estrogen, and the little girls have their period at 8 and they stop growing at 9 because they already got their period. So how do you handle that? Do you see what age group and when do you recommend the hormone replacement?
I'll tell you, my patient population is anywhere from 8 years old till the end of life, right?
Okay.
But the majority of patients that come for hormone replacement therapy or considering if there's a problem with the hormones are people in their early 20s lately, in their
Wow.
early 20s to people like in the old age. A lot of it, the younger population, stems from the fact that they're undergoing so much stress every day with
Mhm.
the economy, everything, et cetera, that their cortisol levels, which is a stress hormone, goes up. And
Right.
one important thing that I help them understand, if that hormone is up, it comes in balance, it hangs in balance with your testosterone, which
Mhm.
both males and females have testosterone. Males just
Right.
happen to have more. But if one of them is up, the other one is going to go down.
Right.
And the solution to that is not necessarily to give you testosterone
Right.
because it's not fixing the problem, right?
Right.
So we analyze and we do our lab work and we do our due diligence of interviewing the patient to know, okay, is it coming from your diet? Is it coming from your stress? Is
Mhm.
it coming from your lack of sleep? Because we will try to solve all those things before putting someone on hormones,
Right.
right? Like I tell my patient, I don't want you to depend on anything. I don't even want you to depend on me. I
Right.
want you to educate you, to learn, so that if one day I'm not here for whatever reason, you can go on, or if you move to a different state, right?
Right. So
So
education is very important. Yeah,
absolutely.
because it's almost like you're going to make a cake. You wake
Yes,
up and your adrenals go up, you're going to make a cake. But if your adrenals are producing so much cortisol and adrenaline, then you don't have any flour to make the other cake, which is like, the
absolutely.
other hormones. So you can go into premature menopause. And that's really interesting. So you're very comprehensive. That's awesome.
Very, very, very. One thing I do is I always tell my patients, I say, I want you to like this should be the relationship with, I mean, from us in the field and
Mm.
patients, right? I said, we need to have, like you said, like a marriage, like the best type of relationship and best communication. If you're snorting cocaine,
Right.
not that I am in favor of that
Right.
in any way, shape, or form, but
Right.
if you are, I want to know. I said,
Yes, we
and
need to
what
know
I
because
said,
if I give you epi, you might have a heart attack.
exactly. I say, I need to know what I'm dealing with
Yeah.
because
Yes.
even if you're not going to listen to my advice, because I'm not going to be your father, but I'm still going to talk to you about the health detriment. But if
Right.
you're still going to do it, I want to know what I'm dealing with to
Right.
see if that is causing other problems. So I don't have to put you in 5,000 medications you don't need.
Right, exactly. Yeah. Yeah. My patients are like, you have like 100 questions. Like, I never went to a dentist that asked me if I poo. Well, I need to know everything because if we're going to sedate you, I need to know that you cannot have codeine because that constipates and you're already constipated. So we have to plan ahead what things are you're going to do after the surgery to be able to release toxins or how we're going to clean your liver after we get mercury out. So yeah, full
Yeah.
disclosure is so important. And that's part of the interview before marriage.
Yes. And I've had a few, very few patients that get defensive when we're asking them all sorts of these questions that seem private. And I said, let me tell you something. I don't know what other people have done, but I'm asking you because I care. I
Right.
care enough to ask those questions that are as uncomfortable for you that they are for me. But we need to know.
Right, that's awesome. You have an ultrasound, right, that you do
Mhm.
on the muscles. What does that show? What can the public learn about that?
A great invention of medicine, a recent advancement, is the use of musculoskeletal ultrasound. The
Mhm.
ultrasound we use is different from the one used for babies just because of how highly detailed it is. And
Mhm.
it allows us to see tendons, ligaments, cartilage tissue. And you can see many of the things, not everything, but many of the things you can see in an MRI, you
Mhm.
can see live on an ultrasound. And what, because you can see it on movement, or you can see the tissue moving, there are a few things that an MRI says suspicious for X, and
Mhm.
even current modern MRIs sometimes tell you in the bottom, please confirm with an ultrasound,
Mhm.
because they know. I see a lot of rotator cuff issues from the shoulder that
Right.
look like, oh, it's likely pulled. But
Mhm.
when you move the muscle, you actually see the tear opening up. And in
Wow,
that case,
that's
I show
so
the patient, yeah, I tell the patient, this is why you're not getting better. And the patient can see it live without getting any radiation at their body.
that is so awesome. So wouldn't like everybody wants to get their whole body MRI with movement like once a
It,
year?
Absolutely. I mean, it has no radiation. It's great. The
Uh-huh.
only issue with doing the whole body is that, because the scan is smaller, it would take hours to do. So at least all the very important parts of the
Oh,
body we
yeah,
want to
like I'll
do.
have a pain on my toe.
Yeah.
Maybe it's something. So would you be able to differentiate, for example, if you did somebody's foot and they have some kind of neuropathy, you can see if it's caused by a nerve pinch or a broken bone?
Yes, you can actually see that. And not only you can see if there's a pinched nerve, but there's a test we do, like in the past, the nerve conduction study, where you put these needles and it's very painful to see if there's a problem with that nerve sending the signal. Yeah, I used to do that test. People hate that test because you have to literally pinch the nerve and cause electricity for the patient to know if it's damaged. So they don't like it. But with the ultrasound, if you're suspecting one particular nerve is damaged,
Uh-huh.
very often you can look and you can find exactly where the nerve has scar tissue around it. You can put a very tiny needle, like the Botox needle that we so much love, like a very, very tiny one, sometimes even with saline. And you can actually kind of like pressure wash, but miniature pressure wash to free that nerve. And very often the person starts getting sensation immediately.
So it's not like even you put stem cells on it, just the saline?
Sometimes saline, depending on how bad it is. Like
Uh-huh.
I always like to start with the things that's going to cost the patient the least and give them the best relief, at least as a test. I said, let's see if this is going to do the trick so you have an idea. And they said, it improved a little. I said, okay, now you know what we're dealing with.
Right.
Let's do it. Mhm.
Wow, that's fascinating. I never heard of that. So many new things and technology that is available to us in this wonderful country that we live in. I love that. So I went to the Paracelsus clinic, but I didn't know that you that did that. I went to visit Dr. Thomas Rau in Switzerland, and they have
Mhm.
an ultrasound that they do check the different parts. And Ali and I, we just were in Switzerland. I said, "Yeah, just check us out." And then the guy did the ultrasound and he said, "Oh, you just get your kidney checked." So I went and got a full body MRI at
Mhm.
Novo, and I found out so much information. I was like, whoa. And you have to be able to handle, how the new information that's coming because as you grow older, it's like things that's changing, but you don't know if you were born with that. So
Yes.
I end up going to the kidney specialist they did all kinds of testing. And it was just that I was born with a kidney smaller than the other. It was something that they said you have to get it checked because it's different. But it's something that definitely makes me want to have a great diet, low salt, and a lot of veggies. So that way I don't do anything that's going to compromise my kidney. I didn't know about the muscles that you can do that. So you have been a doctor, you have treated celebrities, you have been on TV. If today was like the last day that you can impact the world, the humanity, what would you want to do and how would you want to be remembered?
Oh, well, I'll tell you this. The last thing I would want to do is give a chance to a child that has been forgotten, or
Mhm.
that someone that has been set aside. One of the people that joined my practice many years ago was this woman who I dearly loved, who
Mhm.
she had been let go from a doctor's office that she had worked for 30 years.
Wow.
And he fired her because she was older.
Uh-huh.
And he said, I can get younger looking, better looking girls. And I called them to confirm if that was just a story. And no, he said, yes, it's true.
The experience of a person is worth more than anything. Because
Absolutely.
in Spanish we
Absolutely.
say, más sabe el diablo por viejo que por
Que
diablo,
por diablo. Yes, of course. And
right?
I said, you know what? She was telling me she came looking for a job and she said, I don't know what I'm going to do with my age and stuff. And I said, a lot of people would have just let her go and ignore her. And I
Right.
said, I want to give her a chance.
Mhm.
Why? Because I felt it. And because I've always wanted to change at least one life.
Mhm.
And if any of us can change just one life in this world
Yes.
before we leave, we
Yes.
change the entire world.
Yes. Yes, I totally agree with you. And definitely that's living on purpose. It really changes the energy of the room. And there's more. There's a Bible verse that says, do unto others as you would do unto the Lord's. So
Yeah.
that's my mission. When I see a person, I'm going to do everything I got, give everything I got, because I'm representing God. So I want to treat them as if they were God. And then
Hmm.
God does the rest. So you wrote a book.
Yes.
You want to tell me about your book and what made you write a book?
Yes, I'll tell you briefly. I wrote a fantasy book. It's not related to medicine, although I use a lot of medical knowledge when I talk about it. And I am fortunate and blessed by God that it became an Amazon bestseller in 3 weeks. It's called,
Wow.
yeah, it's called The Black Hearts, Book of the Rising Sun. And it is a Game of Thrones type story,
Mhm,
but it's 90 different stories, and they're really the stories of real people
mhm,
disguised as an entertaining, fantastic story.
mhm.
Because it's easier for us to swallow the truth if it looks entertaining, if it looks like Netflix, than if I tell someone you need to be a better mother or sister or brother or whatever.
Right.
People get defensive. And I do that myself too. I said, what do you know about my life?
Right.
But if I show you a story that you read in the privacy of your home
Yeah.
and it breaks your heart
Yeah.
and makes you want to become a better person, I accomplished the same goal and I didn't have to slap anybody on the face, right?
That is so wonderful. So you seem to be very driven, very passionate. I love you. I appreciate what you do. You're changing lives. And it's been a pleasure speaking to you. Is there any question that you have for me?
Y- y- Yes. I mean, you have been a therapist and you can talk about whenever you want about my own medical issues
Eh,
because you were a blessing to me. I mean, I am a patient of Dr. Yolanda Cintron, and I search online high and low because I'm a little obsessive compulsive and I wanted, like, I'm going to give what I think is best for myself, right?
Right.
So I started looking. And back when I went to you, I was living in Miami and it was far, but I said, I need to see who I think is going to be the best care for me because I've gone to so many dentists. They have done a poor job. And I was feeling I had lack of confidence. And I'm on TV. I mean, it had to look the part.
Yeah.
So it was not until I got there to your office that I appreciated the fact that you treated me like I treat my patient.
Mm.
And for me, that was an immediate connection. I said,
Hi, we had a little bit of a technical difficulty. We ran out of battery on the computer doing the podcast. But Dr. Irizarry, Moisés Irizarry, he is a celebrity doctor. He's treated so many sports medicine people, but he is like me. We love people and we don't care the background. We just want to help people. And I love his heart. I resonate with him tremendously. We're going to put all the information about him and how you can reach him and his clinic in Miami. And thank you, Dr. Irizarry, for your beautiful interview. And I'm looking forward to working with you as a patient. And I'm very grateful that you appreciate what we have done for you as well. Thank you.